There's one question I get from dentists who own their own dental practices every single day, and it's such an important question, so let's go over it. And the question usually goes like this: the owner dentist usually purchased or started a dental practice, and after 1 or 2 or 3 years, the dental practice seems to be struggling, and it seems to be stuck at about producing 3, 4, 5, maybe $600,000 a year or somewhere around there. And the owner is kind of getting upset and anxious that the practice is just not taking off, and they're looking for an answer why this is happening. So before we answer this question, let's go over it. What does it take, or what's the common theme with successful, thriving dental practices? So let's go over that first. So just like with any business, it's super important that wherever you set up a business, and a dental office is no different, you got to have a few things in place. So number one, you need to have a need for your business. So that's number one. So you got to be in an area that has a high dental need. So number two is you got to be in an area that's not oversaturated with providers who provide services for that dental need. So let's use the example for a dental office. So dental need is going to be the greatest in low middle class and lower class areas, because people in high middle class and high class areas, they have perfect teeth because they have money and time and insurance and the funds to take care of the teeth. So usually in high middle class and high class areas where that's very affluent, people just really don't need a lot of dentistry, so that's a low dental need area. So if you want a high dental need area, you really want to be in like in an area that's more predominantly blue collar or low middle class or working class neighborhoods, and those are the people who are going to need high dental need. Now, the other thing is the number of providers. So of course, the more dentists there are in the area, the more difficult it's going to be busy, because there are just simply a lot of people providing those services. So a lot of mistakes I see doctors make is going to these super saturated urban areas where there are 100 dentists already in a 10 square mile radius, and there's just way too many providers. So you really want to have a high dental need area where patients need a lot of dental work, and you want to be in an area with low number of providers. And it doesn't have to be a rural area. You can be in an urban area, in a blue collar part of the city where there actually is there are not that many providers. But in general, sometimes rural areas have higher dental need and lower number of providers. So this is definitely want to keep in mind, because if you go into an area, one of the biggest mistakes doctors do is they go into a very affluent area that has a high middle class neighborhood or high class, and patients just don't have any dental need, and it's an urban area where there's lots and lots of providers, and that is a recipe for a disaster for a very slow dental practice, and it's very difficult to overcome that. So to have a thriving dental practice, you also need a good location that's visible, although you can overcome that with good marketing. And remember, marketing is basically people being aware of your business, and branding is people actually choosing you. So you need to work on both of those. You need to work on marketing so people know who you are, and you need to work on branding so people choose you. So successful dental practices and thriving dental practices always go into areas with a high dental need, low number of providers, and then they also work on their marketing so people are aware of their location, and they also work on branding where people actually choose them. And the best way to do that is develop a niche, which is just some kind of procedure that you do that sets you apart from all the other providers in the area. And it's very doable. It could be aesthetics, could be Botox, could be orthodontics, could be surgery, could be implants, it could be a number of things, could be pedodontics, pediatric dentistry. It could be a number of things that set you apart from the other providers in the area, and that could be a huge edge for you, and that will go along with your branding, so patients are going to get more emotionally tied to you and choose you over other dentists because you identify with a certain niche that nobody's really doing, or not many people doing in your area. So these are the items that you really need to have a thriving, very successful dental practice. Now, let's go back to the problem that I get these questions 2 or 3 times sometimes a day, where a doctor is struggling because they have either purchased a practice or they started a practice and it's just not doing well. And what I mean is not the practice is not doing well. That just means that after several years or a couple of years, the practice is still doing under maybe $500,000 or under $600,000, and the doctor is only net profiting maybe $100,000 or sometimes even less from that, but the business is just stagnant and is just not growing, so they're wondering what they should do now. And again, a lot of these practices are in super affluent, wealthy areas with low dental need, and it's also an urban area where there's a lot of providers. So they have a perfect storm to have a struggling practice that's not going to do well because there's no dental need and there's too many providers. So what can you do in these situations? So in these situations, I always tell my coaching clients there's a few things you can do. Number one, you can't change whether or not patients need dentistry. That's just unchangeable. So if you're in an affluent area, you're not going to find a lot of patients who need a lot of dentistry. So you can develop a niche for something that those patients actually need. So if the patients in the area don't need a lot of restorative dentistry, they possibly need orthodontics. So you could learn aesthetic procedures like veneers, orthodontics, whitening. Orthodontics goes really well with general dentistry because that's something that patients even in affluent area really need, and there aren't that many providers for that a lot of times, and you already have a lot of orthodontic patients in your practice, so that just goes really, really well in the struggling practices. That's one of the best way to boost your practice. The other thing is third molar extractions, sometimes dental implants, although affluent areas, a lot of times patients don't need a lot of dental implants either, but a lot of times they do need surgical wisdom teeth removal for the kids. And definitely orthodontics is big. Sometimes lip fillers, Botox, those aesthetic procedures also good, although it's very difficult to build a thriving practice with lip fillers and Botox. But orthodontics is one of the biggest one that you can double your practice and your income. And the second one will be probably surgery, wisdom teeth removal for basically kids under 18. And those procedures can really develop a niche practice for you in an affluent area that's really overserved and patients have low dental need. Now, a lot of times these doctors also ask, what kind of insurance can I add on to? What kind of PPO insurance can I add on to that's going to help me grow my practice? The answer to that is none, because adding on to different PPO insurances and insurance plan is not going to change the fact that you have set up a practice or you purchased a practice where patients have low dental need and too many providers. That's not going to change that. The only thing is going to change is you're going to write off even more of your profits, so your practice is going to be even less profitable. So what you need to work on is pick some kind of procedures that's going to get you growth for the practice. So you're going to have to pick some kind of procedures that you'll be able to grow and provide for those patients already coming to you. Like I said, the only one a lot of times you can think of in these areas is wisdom teeth extractions, orthodontics, some kind of aesthetic procedures, so which even patients who have low dental needs still need, because if they don't need general dentistry, they will need some of those aesthetic procedures, especially if you can double down on that niche and really focus on that with your marketing and your branding. And the third option, which is oftentimes, to be honest, the best solution, sometimes if you cannot grow your practice after, I would say 3 years, it's still stuck in that $3 to $4 to $5 to $600,000 and you're just not getting much growth, sometimes you have to call it quits. And I see this all the time where doctors just stick with it for 5, 6, 7 years and they just have not made hardly any money in this practice, and the practice is just doing worse and worse or just basically stuck. In some of those cases, the best thing to do is just sell the practice. And I had several coaching clients who did that, and they actually learned from the experience and they sold their practices and they went into an area that has a high dental need and low providers, and all of a sudden they have a dental practice that's doing $1.5 to $2 million. So versus struggling for years and years and years and not getting anywhere, sometimes you just have to call it quits and sell the practice and go into another area. So these are really your options in these areas if you have a dental practice in a very oversaturated areas with low dental need. Those are some of the most difficult practices to get going and make it profitable, and doctors today are just committed to set up in these areas. Unfortunately, this is a problem I see daily. There are so many practices in these areas, and a lot of these practices are really struggling, and a lot of times these practices also cost a lot of money to set up, $600,000, $700,000, $800,000, and I see some doctors after 6, 7 years still struggling and just not breaking through with these practices. So, hire somebody to help you and make sure that you go through this process to see if you can turn the practice around. But I would not give it more than maybe 18 months. And if the practice is not going well, I think I would sell the practice and set up a practice somewhere more viable. So hopefully this helps. Let me know if you have any questions. My link is in my bio, and have a good rest of the day. Bye.